You know, when we hear about a major outbreak on the news, it's kind of easy to picture it just starting in a vacuum, right? Like it just spread out of nowhere. But today, we're jumping into this explainer to unpack a massive global mystery, one that literally affects every single one of us. We're looking at exactly how and where pandemics actually begin. Because believe it or not, there's a very specific biological starting line for the world's most dangerous emerging diseases. Let's jump right in and look at the actual source of the problem.
Okay, quick question for you. What do Ebola, avian influenza, COVID-19, and rabies all have in common? Really think about that for a second. Because on the surface, no way do they seem related, right? I mean, they have totally different symptoms, they attack different parts of the body, and they hit the global stage in entirely different years. If you were just glancing at the medical charts, you probably wouldn't connect the dots at all. But from a public health perspective, these notorious diseases share a very specific, totally undeniable origin story.
And here it is. They all involve interactions between humans and animals. Yep, that's the common thread. This is just a massive, massive concept to wrap our heads around. The reality is, most of the human infectious diseases we face today either currently circulate in animal populations or they originally came from animal hosts before making that jump to us. We're not just talking about a handful of freak cases here. This is literally the primary mechanism for emerging infectious diseases. Our health is fundamentally, permanently tethered to the animal kingdom.
So, moving on to Section 1, the human-animal interface.
So, what exactly is this interface? Well, it's defined as any point where humans, domestic animals, wildlife, and the environment interact. And I want you to think of this not just as like a single line on a map, but as this incredibly vast, complex web of connections. It's our physical geography, it's our agricultural systems, and it's literally the spaces where our daily lives overlap with the natural world. Basically, whenever human activity intersects with animal life, whether that animal is totally wild or perfectly domesticated, boom, you have an interface.
You see, when people hear about disease outbreaks, they almost always picture these incredibly dense, super remote wildlife habitats, miles away from civilization. And yeah, for sure, wildlife habitats are absolutely on that list. But consider the others: farms, live animal markets, food production systems, and right there in the middle, households with pets. This interface isn't just in some distant jungle. It exists right there in your own living room and in the supply chain of your local grocery store. Every single time we produce food, farm livestock, or even just hang out with our pets, we are actively participating in the human-animal interface. It's an everyday, completely ubiquitous reality for all of us.
Which brings us to Section 2, crossing species barriers.
Close contact gives pathogens opportunities to cross species barriers. It all really boils down to proximity. Pathogens are super opportunistic. When humans and animals come into close, repeated contact, we're basically rolling the biological dice. We're giving these microscopic pathogens the actual physical opportunity they need to mutate, adapt, and eventually make the jump from an animal host right into a human host. Without that close physical contact, the barrier between species actually holds pretty strong. But with it, that barrier becomes incredibly vulnerable. But here's the catch. The environment isn't static, and human behavior is actively driving this close contact to happen way, way more frequently. We've got these massive global accelerants pushing the risk higher every day. Things like changes in land use and population growth, which basically means we're taking up way more space. And that leads directly to wildlife encroachment. We're forcing humans and wildlife into these unprecedented, super tight quarters. Then you add in the global animal trade moving species around the planet at totally unnatural speeds, plus climate change forcing animals to migrate to brand new areas. All of these factors multiply the risk of pathogens crossing over because they drastically increase the frequency of that really dangerous close contact.
All right, let's pivot to some good news. In Section 3, the One Health solution.
The absolute foundation of our defense right now is called the One Health framework. And this brilliantly illustrates how we completely need to shift our thinking. One Health recognizes this interconnected trifecta: human health, animal health, and environmental health. See, for decades, we actually tried to treat these as completely separate silos. Doctors treated humans, veterinarians treated animals, and ecologists worried about the environment. But the One Health approach tells us that this separation, it's a really dangerous illusion. Because they all share the exact same interface, you literally cannot protect human health without also fiercely protecting animal and environmental health. They are inextricably linked. The whole shebang is connected.
So putting this One Health framework into practice requires some absolutely essential prevention tactics. First up, early disease surveillance. We have to spot these pathogens in the animals before they make the jump. Second, animal vaccination and strict biosecurity measures, especially on farms and in our food production, just to keep livestock healthy. But honestly, the most vital tactic here is collaboration. We need veterinarians, physicians, and environmental experts all working together in the exact same room, sharing their data. When we combine all that expertise, we form this incredible, comprehensive shield that is highly effective at preventing future outbreaks right at the source.
I want to highlight a quote that really hits the nail on the head. Protecting animal health is not only about animals, it is about protecting human lives, economies, and global health security. If there is only one single thing you take away from this entire explainer, let it be this. Investing in veterinary public health and animal welfare isn't just a nice act of compassion for animals. It is literally the ultimate act of human self-preservation. When a zoonotic disease crosses over, it doesn't just make people sick. It shuts down entire global economies and threatens our collective security.
And that leads us to our final part, Section 4, Future of Outbreak Prevention.
Right now, we're transitioning from traditional, reactive disease surveillance to advanced artificial intelligence prediction systems. Think about it. Traditional surveillance basically meant sitting around waiting for an outbreak to start, identifying the sick animals or humans, and then just scrambling to contain it. It was inherently reactive, always a step behind. But today, advanced disease surveillance systems are increasingly stepping up to use artificial intelligence to actively scan vast amounts of environmental and biological data. It is a total game changer, a complete revolution in how we track potential threats.
Because the ultimate goal here is predicting animal disease outbreaks before they ever even spread to humans. We're moving away from simple containment and aiming for true interception. By using AI to analyze complex patterns in animal health, climate data, and human encroachment, scientists are aiming to pinpoint exactly when and where a pathogen is gaining strength. If we can predict the outbreak at the animal level, we can actually deploy vaccines and biosecurity measures right at the interface to stop the pathogen dead in its tracks. We can literally stop the spillover before patient zero even exists.
We've covered a tremendous amount of ground in this explainer today, haven't we? Everything from your living room pet to global AI surveillance. We know the interface, we know the accelerants, and we know the One Health solution to fight back. But before we wrap up, I want to leave you with one final lingering thought. Based on everything we've explored today, what disease do you think poses the absolute greatest future pandemic risk? Just let that sit with you for a bit. Keep researching, stay curious, and thank you so much for joining me.